So mood stabilizer. Here we are going to talk about the medication name, indication, mode of action, side effect, and some key points. So mood stabilizer affect the cellular transport mechanism and enhance the serotonin and GABA aminobutyric acid. It is shortly called GABA, GABA inhibitory amino acid, which are associated with mood stabilizer or mood. So neurotransmitter like GABA inhibitory amino acid or decrease the nerve excitability. Medication that increase the GABA like benzodiazepine or lithium produce a cleaning effect, right? So they work on GABA neurotransmitter. So lithium is the most important or most common mood stabilizer. So lithium concurrent use with diuretics or fluoxetine, methyl-dopa, or non-steroidal anti-inflammatory drugs, shortly called NSAID, increase the lithium reabsorption by kidney and inhibit lithium excretion, either of which increase the risks of lithium toxicity. So if your patient take lithium, it is important to think before what are the other medication my patient need to use. So acetazolamide or theophylline or phenyl-diazine or sodium bicarbonate may increase the renal excretion of lithium, also reduce its effectiveness. These groups of drugs increase the reabsorption. So lithium level get up in blood, but this group of drugs increase renal excretion, means lithium level go down in blood. So effectiveness would be down. The therapeutic dose is only slightly less than the amount produce the toxicity. So here the medication list. So first of all, lithium preparation, lithium carbonate or lithium citrate. Other mood stabilizer we use aripiprazole, carbamazepine, clozapine, gabapentin, lamotrigine, olanzapine, fluoxetine, right? Or quentapine, risperidone, valproic acid. So aripiprazole also has an antipsychotic medication, atypical. Sometimes we use for ADHD or autism. Carbamazepine is a good medication. Sometimes we use for seizure. Or clozapine also has an effect for sedation, and we can use for high blood pressure. So gabapentin sometimes we use for neuropathic pain or lamotrigine, right? Risperidone, another medication, antipsychotic we use for hyperactive disorder or autism, and valproic acid is good medication for seizure. So it is but they have a common medication used for as a mood stabilizer. But lithium, if you ask me what are the primary indication, definitely bipolar disorder. The mechanism, common mechanism of action, they alter the sodium transport in nerve or muscle cell and also metabolism of neurotransmitter. And next go few information about the lithium. So therapeutic drugs level of lithium 0.6 to 1.2 milliequivalent per liter. The actual dose at which the therapeutic effect is achieved and the level at which toxicity appears are highly variable among individuals. The causes of increase the lithium level include decrease the sodium intake, fluid and electrolyte loss associated with severe sweating, dehydration, diarrhea, or diuretics therapy, or also illness or overdose. Serum lithium levels should be checked frequently after initiation of therapy and then every 1 or 2 months or whenever any behavioral change suggests an altered serum level. The blood sample to check the serum lithium level should be drawn in morning and 12 hours after the last dose was taken. Lithium is classified as a pregnancy category D. It crosses the placental barrier and freely and also has associated fatal toxicity. So if my patient has to take lithium, so monitor for toxicity or means monitor for toxicity is very important, like cause tremor, confusion, right? Or EKG change, seizure, tinnitus. So what are the common side and adverse effect? Polyuria, polydipsia, anorexia, dry mouth, weight gain, abdominal bloating, soft stool or diarrhea, fine hand tremor, inability to concentrate, muscle weakness, lethargy, fatigue, headache, hair loss, and hypothyroidism. So here some clue how to remember the lithium, Lithium. So I make a underline LITH. L stand for leukocytosis. Means patient WBC number go up if patient take lithium for a long time. Patient develop diabetes insipidus. So present with polyuria and polydipsia. Too much pee, too much thirsty, right? And also patient develop tremor, T for tremor, and H for hypothyroidism, right? So if my patient took lithium, it is good to advise avoid diuretics and NSAID together. And also it is important to know what are the contraindications. Contraindication for the patient with renal disease. So the patient who have renal problem, kidney problem, they are not good candidate for lithium. Also closely monitor sodium level or need adequate sodium and fluid intake. So intervention, which is important to monitor the suicidal client, especially during improve mood and increase energy level. The medication is administered with food to minimize gastrointestinal irritations, reinforce instruction to the client to avoid excessive amount of coffee, tea, and cola, which have a diuretics effect. As I told you, avoid diuretics and NSAID is important. Diuretics are not administered with the client with taking lithium. Reinforce instruction to the client to avoid alcohol. Also, reinforce instruction to the client to avoid over-the-counter medication. And reinforce the instruction to the client that he or she may take a missed dose with the 2 hours of schedule times. Otherwise, the client should script the missed dose and take the next dose at the same schedule. Before to go next, page, I want to share something more about 2 more drugs from here. So the common indication of all of these drugs are bipolar disorder or seizure or epilepsy. One of the most important drugs from here we use called carbamazepine. Okay. So carbamazepine basically decreases the synaptic transmission in central nervous system. If your patient took carbamazepine, we have to check the blood work. So blood dyscrasis is important to monitor. Patient develop anemia, leukopenia, thrombocytopenia, or vision issue like nystagmus, double vision, or skin rash. So we have to monitor complete blood count or CBC level. Another medication is most important here is called Valproic or Valproic acid. Other name is called Dipacan. So if your patient need to take Valproic or Valproic acid, we need to check liver function test. Be careful when you prescribe, if your patient take Valproic acid, because it can cause hepatotoxic effect. The common side effect of Valproic acid is hepatotoxicity, GI upset, or pancreatitis, also thrombocytopenia. So what is the most important point about Valproic acid? Monitor liver function test, ALT or ALT, and bilirubin level. So next go here, we've done this. Also, it is important to monitor suicidal client, especially during the improved mood, and increase the energy level. So suicidal nursing care is important about the suicidal, like priorities, ask a direct question, or one-to-one observation. Also, place the patient in room close to the nurse station. Also, remove all potential harmful objects like belt, like sharp objects. Also, make a routine frequent at irregular interval or perform the rooms such as needed. Also, such all kind of brought in by visitors. It is very important. So if I ask you who are under the risks of suicidal ideation or suicidal kind, so what are the risk factors? The patient who take lithium for a long time, positive family history, or any, A patient has a history of the previous suicidal attempt, any chronic illness, mental health issue, substance abuser, isolation, lack of access to mental health services, job loss, functional difficulties, or access to a firearms. So if patient have a risk factor like this, it is important to protect them, right? So medication is admin with a food and minimize the gastrointestinal irritation, reinforce the instruction to the client to avoid excessive amount of coffee, tea, cola, which have a diuretics effect. Diuretics are not administered while the client is taking a lithium. Also reinforce instruction to the client to avoid alcohol. Reinforce instruction to the client to avoid OCT medication, or reinforce the instruction to the client that he or she may take a missed dose with 2-hour scheduled dose. We've done this. Reinforce the instruction to the client not to adjust or stop the medication without consult with the healthcare provider, because lithium should be trapped and not discontinued suddenly. Reinforce the instruction to the client in a sign and symptom of lithium toxicity. So if I recap one more time, what are the common signs of lithium toxicity? Means plasma level you have to check, tremor or confusion, seizure, tinnitus, all of this. So reinforce instruction to the client, notify healthcare provider if patient have polyuria, prolonged vomiting, diarrhea, and fever occur, because all of this lead to electrolyte imbalance. Electrolyte imbalance lead to shock. Also reinforce the instruction to the client that therapeutic response to the medication will noted in 1 or 3 weeks. Monitor the electrocardiogram, renal function test, and thyroid test. So here, intervention, monitor the body weight. The client taking lithium is instructed to maintain a fluid intake in 6 to 8 glasses of water a day. This is the question NCLEX board like to ask. Adequate salt intake to prevent lithium toxicity. Lithium toxicity occurs when ingested lithium cannot be detoxified or excreted by the kidney. Maybe kidney doesn't work, or reabsorption is more, or not excrete. The symptoms of toxicity begins to appear when the lithium level is 1.5 to 2 milliequivalent. Here, showing sign symptom, if patient has mild toxicity, serum lithium level is just 1.5 milliequivalent. So plasma level more than 1.5 milliequivalent per liter means lithium toxicity start. Apathy, lethargy, diminished concentration, mild ataxia, and tremor and weakness. If patient moderate toxicity means lithium level between 1.5 to 2.5 milliequivalent per liter. Patient common signs symptom nausea, vomiting, severe diarrhea means GI upset, mild to moderate ataxia and incoordinations, difficult of speech, tinnitus, vision problem, blur of vision, muscle twitching, and irregular tremor. If your patient has a severe toxicity, means serum lithium level higher than 2.5 milliequivalent per liter or 2.5 millimole per liter. Patient have a nystagmus, muscle fasciculation, deep tendon hyperreflexia, visual or tactile hallucination, means you can see something abnormal, you can hear something abnormal, oliguria or anuria, impaired level of consciousness, or tonic-clonic seizure or coma, right? All lead to the death. So if my patient has a lithium toxicity, as a healthcare provider, what is my priorities? What are the intervention? Lithium is withdraw and need to notify healthcare provider. Monitor vital sign and level of consciousness. Monitor cardiac status because EKG change is most common. Prepare opt-in sample to monitor lithium level, plasma level, electrolyte, blood urea nitrogen, and creatinine level, and perform a complete blood cell count. It is called CBC. Monitor for suicidal tendencies. Institute suicide precursor need to follow.